Hello, Nadia.
Hello,
Hello, audience. If you're having today's Friday.
everybody.
Yeah. I want to say happy Friday, but I don't think you guys will hear this on a Friday. Maybe you will.
Yeah, maybe.
Who knows when people listen to our stuff? Sometimes I assume that nobody's listening, but then I don't know. At least once a month, a random person will tell me that they heard our episode, and I'm always
hmm
thrilled.
Yeah, same.
Um, so this week, something came up at work. I mean, often this thought comes up for me, but it happened pretty recently at work, and I wanted to bring it up today. And it is regarding your future career as a physician, as a medical doctor. And
hmm
what came up during work today was me talking with two of my coworkers who are physical therapists and us relaying to each other the complaints that our physical therapy patients had about their experience with the medical system, specifically their medical doctor. And I get worried about you becoming a physician
hmm
because for many reasons, but I wanted to talk about that with you today. And I have numerous concerns. Shall we start from the beginning?
If you so desire.
Is it going to freak you out that if I bring this up, do you think, oh God, she's going to I'm afraid she's going to stray me from becoming what I want to become?
No, because I know what I want to do. It's just like, I don't know. Everyone has their own opinion, so it's okay. Also, we've had this conversation before, so it's okay.
Oh yeah. I mean, you're in your fourth year of college. It's coming really close. I mean, like before it was very much, you've been talking about going to medical school and becoming a doctor since you were probably in eighth grade or something like that. So
hmm
it was like very much hypothetical, but now it's for real, and okay, let's start with number one. Number one, like you, I am worried about how difficult it is to get into medical school, which is so crazy
hmm
because, like, for example, my coworker was trying to get in to go see a doctor because her eye hurts. She has this big eye thing that's been going on since July, and she's like, I need to see a specialist. And she couldn't get an appointment until February. And I'm like, okay, if that's the case, we need more doctors. So why is it so hard to get into medical school? I mean, clearly we want good doctors, and that's why it might be hard to get in.
hmm
But so yeah, my number one thing is I'm worried about you not getting into medical school.
Yeah. I mean, it's always a valid worry for like any grad school endeavor or any career that like makes it so you have to go to grad school or get a graduate degree, master's degree, all that kind of stuff. Like, it's never going to be easy to get in somewhere. But I feel like if that's like the only problem, I don't know. I, I'm kind of losing my train of thought, but like, that can't be the only issue because if it's like meant to be, then you've put in the work and you'll get in somewhere. And like that, I don't know, shouldn't be something that deters you from being a doctor. I mean, if it does deter you, then you weren't supposed to be a doctor, like, is
If you don't,
my reasoning. And I also, like, me personally, don't feel like I'm in any sort of rush to get to the end goal. Like, I want to do it right. So it's not like I don't need to, like, get into medical school by a certain time necessarily. I guess there are some time limits, but like, or time constraints, but I don't know. I don't know where I'm going with this, but I feel like it shouldn't like deter someone from being a doctor.
so if you don't get in the first time you apply, you'll apply again.
Yeah. I mean, that's what people usually do. You might have to take the MCAT again if it's like if your MCAT score is expired, but yeah, I would just apply again. I mean, also like I could get in somewhere that I don't want to go to. Over. Like, I mean, it's a lot of money, but if it's like, if that is what I want to do, like, that's the only way to get there. Like, there's no other, like, roundabout way. But yeah, I'm not really sure why it's so hard to get into med school. I feel like that's a valid question, like, for me too. And I don't know, I guess you'd have to ask, like, a med school, like, dean or something. But I don't know, you wanna select, like, the people that you actually think are gonna be good in the field. And I don't know. I don't know
Okay.
why they wouldn't have more people, but
Yeah, and I guess if you don't get into an MD program in the United States, are you willing to go to another country or explore DO programs, which are also challenging to get into also? And that wouldn't be the only reason why somebody wants to become a DO. There's like very valid reasons to choose DO over MD, but supposedly they're slightly easier programs to get into. Would you be willing to go out of the country?
I mean, like, I don't really know. I mean, I can't really debunk any of these because it's like I haven't gone through the process, and I guess it was hypothetical before, but it's still hypothetical now because I haven't even like stepped into that process yet. Like I've only taken the prerequisites, which doesn't really mean much and could like lead me in any direction, but I guess like yes, I don't really know what that entails as far as like coming back to the US to work as a doctor. Um, Obviously I love traveling and that would like it would be cool to be in another country, but I'm not quite sure how that works in the long term, only because I haven't like researched that. I feel like I don't know. If I tried once and didn't get it, I don't think I'd turn right away to going out of the country. And as far as DO programs, I feel like, or any program, honestly, like PA also, like that wouldn't be because I didn't get into med school. It'd kind of be like if I decided that's a program that I want to do instead, like not like a backup, but like three options, But I don't know. I'm not there yet, so.
Okay, so physical therapy school is pretty hard to get into also.
Mm.
And sometimes when I meet young folks that want to go into PT school, I say that some of my favorite things about being a physical therapist include teaching exercise and doing manual therapy, like my hands on whatever body part needs to be treated.
Right.
And that, you know, if you were to become a personal trainer or Pilates teacher and a massage therapist, there's some similar things that you're able to do. You're still teaching exercise and you're still doing body work, right? And so, but so I tell people like, that is an option. So do you know what the components of being a medical doctor are that you like?
What do you mean?
Like, like I would say the components of being a physical therapist that I like include teaching exercise and doing body work. And I could do
Yeah.
both of those things and not be a physical therapist. I mean, there are other things that I like that I can only do as a physical therapist, like a full physical therapy evaluation and plan of
Right.
care. But some of that kind of thought process happens in for example, a Pilates teacher's mind and in
Yeah.
a therapist's mind. So I'm just wondering, like, what are the components in being a medical doctor that you like? And then the follow-up question would be like, are you able to do that with a different,
Uh, well, I know this answer to the second question is yes, but I think right now, like just base it off of, or like comparing it to being like a PT or what you said about why you like being a PT. I feel like it's intriguing to be able to treat like illnesses as well and like chronic illnesses and like not just like I guess we don't cure aches and pains, but like we help in that, or we medical doctors help or providers help in that department, but it also extends to illnesses and like things of that sort. So like there's more things to treat, I guess. And it's like you get like a whole realm of things instead of I feel like PT can be a little bit more, I guess maybe your PT practice is pretty specialized. So it's like, I don't know, I guess feels more, I guess it's general, but it also can be considered like well-rounded. Like it's just like there's a lot of different things that I could do as a medical doctor. And Um, I know that, like, PAs and
NPs?
honestly and NPs, yeah, they can do similar things as well. But for me, well, one, as far as being an NP, like, I give so much credit to nurses. Like, I don't think I would be, like, I think I'd be good at it after the fact, like, going through all, like, the schooling and the training and all of that. But they are really, like, hands-on in a patient's care in a way that medical providers aren't as much, which I do like the hands-on care, but they do so much and, like, I don't know. They also don't get enough credit, but I feel like that realm would be a hard path for me to go on, and I knew that maybe that wouldn't be, like, the direction I wanted to go in. Um, that being said, not that I couldn't do it, but that didn't seem like something for me. And then for PA, honestly, like, it is a valid option I can consider. I've had, like, many conversations with you about it. I don't know how, like, I don't know. I feel like maybe one thing that's on my mind about being a PA is that there's not as many PAs on the West Coast, and ideally, I'd want to go back to the West Coast at some point. Not that that would, like, take away on any opportunities for me, but just, like, make it a little bit more difficult. But it's still a valid, like, option. But I'd have to I think, like, some of the requirements in training is just a little bit different. But I don't know. So, yeah.
So all that to say, my second concern, which that the training and the timing, the schooling to become an MD is so long and extensive. And from what I hear, tiring and stressful, but doable, right? But like, it's a lot. Like you have to want
I
it.
feel like
And so that's the second concern is that are you going to be okay physically, mental health wise, going through the rigors of medical school and residency?
I mean, like, I don't know. You talk about this I talk about this to so many people, and they all say, like, things like that, but it's like, but everyone is always like, "If you really want it, then it'll work," but, like, I do want it, so it would work, and I think that, like, that the timing is a lot, the schooling is a lot, but that is what deters people from being a medical doctor, and so when you say things like, "Oh, you couldn't get an appointment with the specialist for, like, 6 months," it's like part of it is, like, people are very deterred from being a doctor because of, like, the things that are in between, like, the idea of it and actually being one, and, like, we need people in the health, like, field, so, like, that my end goal is what I'm aiming for, like, if I have to go through all that school, then that's, like, what I have to do, or you know? But yeah, I mean, I know I could do it, so I just feel like if I make it that far, then obviously it will be hard. But I also feel like a lot of other career paths are hard like that, just in different ways, and, like, I don't know what the word I'm looking for is, but, like, I'm more willing to sacrifice that to be a medical provider than to be something else. So, I don't know.
Yeah. Well, you're also, pretty good at school. So if
Yeah.
the barrier is school, you got that. If the barrier is like having to work a lot of hours and have like not that much sleep, you've got that. So I guess, I mean, for some people, that's a lot more of a sacrifice because they really have a hard time with school or they don't like school, you know.
Yeah. Also, like, I feel like I'm a pretty academically motivated person, or, like, able to feel more in control of my life when I'm doing school versus when I'm working. And so, like, managing medical school, I think, honestly, would probably be easier for me than managing, like, well, granted, I am taking gap years, but, like, managing, like, post-grad life. Like, I think that it gives me more structure for longer, that I think I will like, be more successful in, if that makes sense. But yeah, I do wanna take the gap years because a break is always good, and I don't really wanna get stuck in this for a long time. Schools, so that's why I'm taking the break in between, but yeah, I feel like school usually not doesn't come easy for me, but it's like, something that I think I'm good at figuring out.
Okay, so what came up this week and the third concern is that I feel like as a society, or physicians have been put on a pedestal. And then our expectations of these professionals on a pedestal are high. And then they get like 10 minutes to see us. They barely know us. And then oftentimes patients are disappointed with the
Mhm.
outcomes or whatever advice they got from the physician or
Yeah.
lots of things, just like so many things, like the words that the doctor used, the
Yeah.
fact that the doctor didn't know about the latest trends in, I don't know, creatine, or the fact that
Yeah.
all the doctor did was prescribe me antibiotics, but not get to the
Yeah.
root cause, or the doctor was like, I waited whatever, an hour because they were running late
Yeah.
only to get like 5 minutes with them. And then just like, I was talking about my pain. They didn't even touch me. Like all the complaints, we always hear these complaints as a physical therapist because we get to have more time with the patient and they get to tell
Mhm.
us like all the reasons why they were like frustrated with their appointment. And I don't want you to be the recipient of all of that, like ire, like people getting fainted. And most people go into medical school to become doctors and to help people. So the intentions are good, but for real, like a lot of people complain about their experience with a doctor. And if you go online and look up a doctor and they have good reviews, it's like a surprise because most of the time people will put bad reviews. And so I'm like, worried about the pressure that that puts on you, and then just like people, I don't know,
Yeah. I mean,
like,
but it's, like, hard to be, like, thinking about what might happen. I mean, goal isn't to be, like, a doctor that does that, and I think that obviously that's not anyone's goal, but, like, it's not always, like, our fault that or our fault. Well, 1, it's not always our fault as a patient that or I don't know where I'm going with this, but it's not always the provider's fault that they don't have, like, that much time with the patient, and I feel like to be a good provider, you just have to make the most out of whatever time you get, and you're right, like, they're put on a pedestal, and they put themselves on a pedestal, but I don't know. It's hard to be like, "Oh, but what if someone tells me, like, they're not happy with what the care that I gave them?" But it's also, like, as a PT, that can happen to you all the time, and it's like, I don't know, there are, like, you guys speak from experience of being, like, a good PT clinic, and there are bad PTs out there that have very similar bad experiences to the ones that you describe with, like, a medical provider. So it's like, I don't know, I feel like if I'm in those circumstances, like, just to work to be the best that I can, I don't know, like, it's hard for me to, like, look at it from right now, or even if I was a doctor right now to think about, like, "Oh, what if this happened?" But that would never be my goal to just, like, kind of see a patient, move on to the next. And I don't know. I don't really know, like, how to describe what I'm thinking because I haven't experienced it yet. But yeah, like, I'm not necessarily deterred by that just because, like, it's all a lot of what ifs and, um, no matter what you do, like, there are gonna be people that are disappointed, like, I work at a cafe and people are disappointed all the time, and it's literally just coffee, and people just have high expectations, so it's like, you can't really, manage what their expectations are gonna be like, so, I don't know. Not everything is the, like, provider's doing, you know? Like, I can go into an appointment and be like, "I can't believe I had to wait that long, it's really annoying," but, like, that might not have been the provider's fault. Just, like, put blame on them.
Yeah, I feel like it's too bad the system seems kind of set up against medical doctors. The one patient this week said, "The last 2 times I went to my medical doctor, they were wrong. They got this wrong and they got that wrong, and, like, I know that because they prescribed me something, I didn't believe them, so I asked like, I figured it out on Google, and then I did the
I
Google
think,
thing, and
like
it was right."
I feel like that's what doctors probably hate the most is, like, when people go up like, look things up on Google, which I've had this conversation before, but I can't remember if it was, like I think it was on this podcast, I just can't remember with who. But it's like, you can't stop people from looking things up on Google, but, like, they have to not think that they're you know, like, what they think is or what they've looked up is the only right answer, and, like, maybe you think the doctor's wrong because you already went in with the idea that the doctor was, like, not gonna give you the right thing, which has, like, happened to me before. But it's like, I don't know, I'm not that like, I don't know more than the doctor, and also, I don't really trust myself completely to find the right answers on Google. I don't know, it's, like, hard. You can't like, that again, you can't really, like, manage how people are gonna go into the appointment thinking, like or what they're going to go into the appointment thinking.
Okay, so finally, the other conversation on a positive note was
Mhm.
I had a conversation with my college friend, and her physician, her that just delivered her baby, was so good, right? So, so okay, my friend that had the baby had a delivered the baby and had a good
Mhm.
experience with the medical doctor, and I
Mm.
knew the medical doctor also because I went to college with.
Uh-huh.
And
Uh-huh.
I am so impressed with how good of a doctor she is, like,
Mhm.
she was just amazing. And me thinking about you, I was like, "Tell me how she was amazing." Like, I wanted to,
Mhm.
like, "This is how you become a good doctor."
Right.
And she's like, "Well, she just seemed, first of all, very confident, and
Mhm.
she explained things more than once. She really wanted to make sure we understood what was happening, and
Mhm.
then when we were at the hospital, it was really clear how much everybody out in the hospital really respected her. Like,
Mhm.
super, like, from the nurses to the other doctors, they
Yeah.
really worked well with her because they respected
Mhm.
her skill and expertise, and we just felt really lucky to have her delivering
Mhm.
our baby. So, I guess I won't name my friend, but I'll name the doctor. It's Dr. Kathleen Valenton Asurin from Beverly Hills Women's Health or something like I forgot what her name
Mhm.
this is called. But anyway, I mean, it's only good stuff to say, so I can name her. Yeah, so, like, that being said, I'm wondering, in the doctors that you've seen interact with patients or in what
Mhm.
you picture yourself to be as a good doctor, like, what do you think makes a good physician?
I mean, all the things that you described, it's like you have to be a good communicator and, like, compassionate and, putting the patient first. I think it's hard when if you have, like, a doctor just, like, that might, like, assume that you know things already, like, this is, like, unrelated, but related. Like, I'm in a physics lab right now, and I have a TA that's supposed to be there to help me. He's a grad student, like, supposed to be there to help me and speaks to the rest of the people in the class like we should already know how to do these things and is, like, you know, not very good at communicating. I think that translates to being a provider as well. Like, you just have to explain it in the simplest terms so that they understand what's happening and as much as possible, like, communicate as much as possible and just, like, being kind and understanding where the patient might be coming from because everyone's different. I don't know, maybe the doctor would have, like, done things a little bit differently with another one of her patients, but it wanted to make sure that this specific patient, like, had each step, like, explained, which I think is really helpful. I don't know. Like, I feel like these are a lot of things that I'm learning about in my classes, and hopefully I think things that are trying to be targeted a little bit more in medical school or toward for medical students. I think it's helpful for me that I'll be coming from with a public health background because I feel like every one of my classes or public health classes talks about things like this and like how to treat the patient in the best way or even communities and patients in the best way possible to achieve like the best health outcomes. It just doesn't just include like giving them the correct medical advice, but like everything in between. But yeah.
Well, speaking of like, you having your public health background, I think also having two parents that are, allied health professionals
Mhm.
is also important. We've talked to you before about communication between physical therapists and medical doctors,
Yeah.
between pharmacists and medical doctors. And I'm hoping that you'll not only be good for your patients with your patients, but also be good
Mhm.
with the team that
Right.
is around the patient and
Mhm.
realize that like, you are responsible for knowing a lot of things, but that there are other people that are part of the team that are good
Mhm.
resources that,
Mhm.
that know something that you don't know, you know?
Yeah. Yeah, agreed. I think like it is like you guys are still medical providers in your own way, but like it is different to grow up with you being a PT and my dad is a pharmacist than to have like both of you be doctors because I'd only see one perspective. And I mean, yeah, I agree. I think it is and will be helpful when I'm like in medical school or even just working in a health center or a hospital. But yeah,
To be
I
clear, we're
don't
both
know where I was
doctors
going with
also,
this.
just
Yes.
different kinds of doctors.
Yeah. That's what I meant. I said that. I said medical providers, but I meant like different doctors.
No, we have the degree, but everyone knows that when you say my doctor, you don't mean your psychologist, you don't mean your dentist, you mean your medical
Right.
doctor.
Right.
I think I feel good actually letting you know all of my concerns.
Yes, I know. You like to voice them, but I mean, like, if someone, I don't know, I guess what would I do if nobody brought up these things? I don't know. Just assume that everything was going to be easy and like straightforward from here on, but yeah.
Did you know all of those concerns already?
Yeah, I mean, I talk about these things all the time in my public health classes. Like, I know, it's not just you guys, it's everybody has these problems, but I mean, like, honestly, literally, what can you do except, like, try to be the best provider you can, even for you? Like, I don't know.
Okay. Well, on that not so stressful note, no stressful note, I don't know. On that neutral note, um I will try to stop voicing my concerns because now I know that you know all of them, and I will, from now on forward, be supportive of. I do. I am excited about you going to medical school and becoming a provider and doing all the things that you've been talking about doing, preparing yourself
Mhm.
for since you
Yeah.
were younger. And I really do truly see that. I can see you being
Mhm.
a medical doctor. I mean, that's like not, that doesn't seem like that it, what do the teenagers say? They say that tracks or that, I don't know.
Checks.
Yeah.
That checks.
Yeah.
Yeah, I agree.
Yeah. But, yeah, so it is a hard path. So what can I do now but just be supportive? So no more concerns, just support.
Mm, well, you can still voice your concerns. So that'll be fake support. I don't want fake support.
Well, you already know all my concerns.
I'm sure you'll think of a couple more as we go
Oh, there's
on.
the money. There's a tuition. We didn't talk about tuition.
All right, starting up a new list, I guess.
All right. Well, have a good weekend,
Bye, everybody.
everybody.